Welcome back, everybody. As a parent, we cheer on our kids when they're playing sports, but cringe when they get hurt. Most of the time, it's a bump or a bruise, but serious sports injuries are not that uncommon anymore in high school sports, so the more we know, the better off we are. Well, joining us now is Dr. Owen O'Neill from Twin Cities Orthopedics. Good morning, and thanks for joining us.
Good morning. Thanks for having me.
All right, so there was a big summit in Washington, D.C. aimed at protecting high school kids in sports. There's now a national action plan for sports safety. What does that really mean? And I know there were several recommendations that are made at this point.
Right. So what it means is that our goal is not only to prevent injury, but we'll treat injuries when they occur. But if we can prevent injuries before they occur, we feel that athletes will be healthier and happier as they play sports. So there was a summit last month in Washington, D.C. for a youth sports group that allows national recommendations in terms of preventing injury and then treating injury when they occur.
Kind of trying to get everybody on the same page here is what it sounds like as well.
That's right, because it's been very fragmented around the country in terms of recommendations.
All right, let's talk about some of those recommendations.
Sure. So the main recommendations would be, number one, you have to have a healthcare team. Usually it's a partnership with the school, but that partnership would be an athletic trainer that the school usually has or provides. Teamed with a physician that would help any athletes that may be injured along the course of a game. And there are some games where we have a physician present. Other times physicians are present, but we're available for consultation.
Wow, and this sounds like it could run into a little bit of a budget issue as well for the schools. I mean, they all, I guess, don't have athletic trainers and physicians right there and ready.
Yeah, some schools wouldn't have athletic trainers. Most of them do, particularly in this region. And then, we as physicians, we've actually volunteer our time to cover sporting events for the schools.
And how important is equipment, proper fitting equipment, and educating folks on how to use it and how to get it?
Yeah, so that's another major recommendation is having not only the proper equipment, but the instruction for the athletic trainers, the parents, the student athletes in terms of how to fit the equipment properly. It doesn't help you to have the proper equipment if it's not fit properly.
All right, and how important is it to maybe inform parents of some of the risks that are just there if your kids are playing sports?
Right. It's important that the parents and the students understand the risks, but they also need to understand the role they play in minimizing injury, both to themselves and to other participants in the sport.
All right, so those are some of the recommendations from the summit. Let's go over some of the most common injuries that high school athletes are enduring.
Very common injuries would be ACL injury, which is an injury to one of the major knee ligaments. And that is often treated with therapy, sometimes requires surgery. It's very common to have shoulder injuries, particularly in overhead athletes and also swimmers. Elbow injuries are common in throwers like baseball players. And we see ankle injuries like not only overuse injuries, but ankle sprains and other type of ankle injuries, particularly in cutting and pivoting sports, basketball, soccer, football.
And then, of course, this has nothing to do necessarily with orthopedics, but we hear of these athletes that are just dropping over, and there comes in the importance of an AED nearby.
Right, exactly. And I've actually brought an AED here to show it is important not only for athletes, but this is a way that you can, as a either passerby or parent or someone that's around, you can actually save someone's life when you have an athlete or someone who just basically crumbles and they're not breathing and they have a heart arrhythmia. All
right, well, we gotta make sure we get to this because Twin Cities Orthopedics has a free sports medicine conference for coaches and parents. It just has to be very important for everybody to be informed. Tell me why somebody should come. Why should coaches and parents be at this big conference you guys are offering? And it's free. It's
a free conference. It's this Wednesday in our Edina location. And it's important because we want to, at Twin Cities Orthopedics, we want to treat athletes that are injured, but it's also very important to us that we actually help prevent injury. And so this brings it all together with the coaches, with the parents, and the students. It allows us to teach these recommendations and help people not become injured, including some very innovative technology we have through physical therapy, which allows students to really operate at their peak performance. And if they're operating their peak performance, the chance of them becoming injured becomes much less.
All right. Well, again, the Twin Cities Orthopedic Sports Medicine Clinic is Wednesday, February 27th. It's from 5 to 9 at the Edina location. It is free. And again, parents and coaches all encouraged to attend. Dr. O'Neill, thanks so much for all the information. We appreciate it.
Thanks for having me.
All right, Steve.